Start, sir.
So this is your model for and software for a paper-free e-hospital. And how does it differ from the software used in other hospitals?
If you see, predominantly, many hospitals use management information system alone. They don't have clinical information system, which covers the basic, every instance between the doctor and patient and or run through the treatment process is covered. And this is not integrated with the MIS system. That is why we have differences and discrepancies in billing vis-a-vis the process everywhere. So the first time we have attempted to create a e-hospital infrastructure, we have designed a product called SHIMS. It stands for Comprehensive Health and Hospital Information Management Enterprise Solution. So here what we have done is we have linked the EMR, the electronic medical record, along with the MIS system. So it completely caters the gamut of service the hospital is providing, and it is covering the business process as well as the clinical process. The job is created in such a way that from within the hospital and outside the hospital, access is given from a detailed to abridged way. We have implemented this system. Now this is now running for over 3 years, and it's quite.
No, what do you mean by detailed and abridged?
doctor and
detailed to the doctor and abridged to the patient.
So essentially, you are saying this is a more personalized
Absolutely.
model.
Absolutely.
so what is the essential benefit to the patient?
First, they have the facility to get their summaries in a detailed, printable manner. And when they come to the hospital, subsequently, they don't need to bring any of their identity called an OP card and IP card. This is a completely biometric interface system. All that when they feel ill, they have to just come to the hospital. We take care of.
Oh,
That's very, very nice because when you're ill, your first thought is to rush to the hospital.
Thought is to get to
So
the
this
hospital.
ensures better transparency and better accountability and
At the same
better
time,
service to the patient.
at the same
also.
time, it's fully secure and protects
And
the
you don't have to
confidentiality.
carry all those.
And
monthly
yes, that's a very
stuff.
nice. And one thing I would like, can it be replicated and can it be scaled up and down?
Absolutely. There is no limitation.
Okay.
You can start this with outpatient clinic
Okay.
to nursing home to a small, medium, or large hospital, irrespective of the size of the hospital or number of patients. This is fully funded.
That's really nice.
Over here, how do you function? I mean, what are the functionalities of this?
So if you see this entire flow chart, I've given you in two phases. One is the total concept is given here, and the detailed version of the product and the services
I
given
know we
here.
are standing right here
Exactly.
at reception. So
Exactly.
What do they do? I mean, as
So
soon
right
as the
from-
patient comes in here,
Yes.
they're taken care of.
Exactly.
Right?
Now, what they do is right from registration to billing happens in the reception. So this is integrated, and once they go further, if you see, then it goes to ward management, inpatient, stores, pharmacies, from the MIS side of it. When they come to the services, the nurses they take care of, and or the associate physician takes care of recording the history, and then it further goes to the chief of the department, and then whatever is required, any lab investigation, imaging services, and then the consultants and the hospital or visiting consultants, they are also integrated in this. Now, as I told you, all the clinical information and the management's information is integrated with this. Once the patient comes, they go through the process, and without any hustle and the delay part of it, it goes as a smooth operation.
So it's very much more hassle-free for a patient
Absolutely.
than any other
Absolutely.
system.
Absolutely.
Any other unique feature of this thing? Like, suppose they are not able to rush to this hospital.
Yes, they can do a phone consultation, they can do an email consultation, where the doctor, no, where exactly, so where the doctor has got complete access to the patient's records, comprehensive. It's not like one-off kind of thing. All the data about the patient is available with the doctor, and this can be accessed, as I told you, through various gadgets. So wherever the doctor is,
All
let's
over
say
the world.
All over the world.
anywhere in the world.
Yes.
So they can have absolute access to the data through a secured access through flow, and then they don't do a guesswork. They are very clear as to what is the condition of their patient, what is the current scenario, how, and they relate it.
Does the patient access it or the doctor elsewhere?
The patients can access their, as I told you earlier, the summary level data. They get access to this.
In an average.
The detailed access is given to
And
the
they
doctor.
have a password and everything.
They have a password. There's a login and password, which is invariably the patient's ID. And they have a password. And
They have a password.
Exactly.
We could move on to this nano health insurance, as you call it.
Right.
Insurance is a.
I mean, how was
How
this
would you distinguish it?
from the normal health insurance policies which are floated by all other organizations?
Yes.
So you used a very unique term, health insurance,
Yes.
by which I think you mean ensuring the health. Could you please explain about it?
I can explain it from a layman's perspective, because clinically it's a very detailed explanation.
Please do,
From
because
my-
we are laypersons.
Yes, we are laypersons. So
No,
we would
anyway,
like
clinically I don't want to say because it's a doctor who has to explain, but I'll tell you the concept. if you really look at insurance and insurance, insurance is something that is commercial business like. It's now like there is a product and there are limitations. You have inclusions and exclusions in this. Whereas insurance is overall ensuring good health. We don't discriminate someone as, say, A diabetic, B hypertensive. This is not included, that is not included. We don't do that.
There are no ifs and buts.
Exactly. See, like from this entire poster, now you can see an aeroplane. We have depicted this only to give you one concept in an aircraft. Whether you are flying business class or first class or economy class, the time you leave point A and the time you reach point B is the same.
Is the same.
It is only the service.
Of the
Exactly. So it doesn't mean that first class goes first, business class goes next, and the economy goes third.
All of them take the same time to reach their destination.
Same.
So similarly, the premium you pay does not.
Exactly.
Okay.
But in the later part, I will tell you how it is different.
Okay.
Now, insurance is basically giving you the confidence that I am insured of good health.
Okay.
When I enroll,
That sounds very comforting.
exactly. So there are no products like at the insurance company that these I will cover your eye, ENT,
Okay.
then someone else will cover your cardiology and renal system. It does not mean a product. We don't divide the body, human body, into different products.
It's a comprehensive
It's
goal.
overall ensuring good health. We don't treat just illness. This is a paper we presented in Athens in 2009, and the model is very well accepted, but it's yet to take shape into what we call as a workable model. But at TAG-VHS, we are almost ensuring close to this.
Very
Many of our patients, we are able to give
That's very
service. So when you really look this particular thing, you can see something called SG and NG. This is basically the This is basically the model of what we were promoting.
Okay.
Okay.
If you before I go to the commercials, I will tell you what it is. There are 4 different groups.
Okay.
Then we are talking about these groups. We have got free beneficiaries. When I mean free, for every person paying the premium, up to 4 people are treated free.
That is really good.
Okay.
Okay. Now at different levels of entry, different levels of people get free treatment. It could be your parents, it could be your relative, or it could be somebody helping you, like your driver or your housemaid, whoever it is. They can be enrolled into this program. Free. They are treated completely free.
Okay, that is.
Okay. That is, as I told you, in the aircraft
So you
model.
pay for yourself and
You
And
also
you
get
ensure
others.
that 4 others get
Yes,
benefited.
up to 4.
Up to 4.
Buy one,
Up
get
to
one
4 are
free.
free.
Exactly.
No, but this is really nice. Because
Okay. Now, if you really go, this is just a small model of working we have made in terms of numbers, because everybody wants to know the numbers. What is my commitment? Now let's talk about people earning anywhere between 10,000 to 50,000 rupees. It's basically like up to about, we are talking about somebody like earning from 3,000 rupees to 3 lakhs of rupees a month or even more. Right. Now what we say is you only pay 1% of your annual earning as the premium. Okay. So if you say somebody like earning 100 rupees a day, he pays 1 rupee. If you compute that entire thing, let's say that he is earning about 36,000 rupees a year. So he only pays 1% of his premium, and we say that we are enrolling about 100,000 people. This is the revenue we will be generating. Now, as we go along, it keeps increasing. The more they earn, still it is 1% of their annual income. Okay. If you really calculate,
As against an insurance policy where it's a fixed premium.
It's a fixed premium.
Irrespective of your income.
exactly.
here it is an insurance.
It's a graded
because
system, so I think
it is a percentage.
Exactly,
Yes.
exactly. So, if with that difference in earning, they have complete protection, as I told you, ensuring there and they are near and dear ones.
That's really nice. That's very
So
nice.
this is a model which is now gaining popularity. We are very sure that this will become a workable model in few years from now. Thank you.
Thank you very much. Thank you.
I'm Dr. Deepa Krishnaswamy, MRCP UK, and I'm one of the energy consultants at TAG-VHS Diabetes Research Center. And what the pioneering work that's happening here is based on a patient's result outcome basis. One of the main problems in medicine today is overdiagnosis and over-treatment, and I'll be explaining to certain people what that means.
Really, Corey.
Cut.
Hello.
Hello. So I was just telling that one of the main problems today is in medicine is overdiagnosis and over-treatment. Because do you have any doubts as to do you have any idea as to what it means actually?
Actually,
one doesn't understand because we go to the doctor
Yes.
for treatment.
No, if for
So
say
now,
for
if
example,
you say
you have a
overdiagnosis,
headache.
what do you mean?
If you have a headache, who do you go to?
I mean, the ideal thing would be
That would be the
ideal-
right answer.
Yes.
Because what is happening in today's world is when you say a headache, they go to either